And there we are. So welcome everybody to the VBF Facebook Live for March of 2022. I almost said 2023. I guess I'm rushing things. I'm just checking here on my phone to, yep, I see us. So I can see us, so I can see the questions come in. And I already see 2 people, 5 people are on. Anyways, welcome everybody to the VBF March 2022 Facebook Live with our VBF Italy director and also our VBF Europe co-director, Dr. Giacomo Colletti, live from Milan. He's in Milan, I'm in New York. Hello, Dr. Colletti.
Hi, Linda. May I just take a minute? Because I really want to say thank you, Linda, for what you were able to wonderfully organize in Milan when we did our free laser day, free laser clinic. It was just, I mean, we were able to help more than 30 people from 18 countries. And I mean, as always, VBF is in my heart, and I think in the heart of many parents and patients. I also wanted to say thank you to Laserblast and Dr. Clementoni, who offered for free his clinic, his hospital, I would say, and also to Candela, who provided 2 lasers for free for the entire day. So I am so grateful to you, to Laserblast, and to Candela. It was a really heart-filling experience for me.
Yes, it was wonderful for myself too, especially with everything going on in the world. It's good to have something positive, isn't it? And that meant the world to me. And usually I have to chat for a minute, but your patients are slamming already. We have 22 people on with questions. So the first one comes from Zinc Shakar, and he wants to know, I'm 32 years old. What is the best way to treat a port wine stain?
Well, okay, the answer is not so simple. And I mean, with this, the fact that port wine stain in the adult are more often than not just stain. There are hypertrophy and cobblestoning. So in very simple cases, one may just go and laser it to try and blanch it a little. But more often than not, as I said, there is some need for surgery to correct the overgrown soft tissues and or bone. So it's a combination.
And what I can say to him is, Zinc, you can email Dr. Coletti through the VBF website at birthmark.org. You'll see him as one of our experts, or you can email me directly and send your photo, and then Dr. Coletti can give you a opinion on whether you would just need straightforward laser, or if you need the cobbling, if you have any of that to be addressed surgically. But at least we can get you started and in the process, and then you can always go to Italy if you can go there. If not, we'll figure out what's best for you. So we have 24 people on, and people are saying hi. Ava Piles is saying hi, Dr. Coletti.
Hi, Eva.
And Scott's on, he's saying hi as well.
Scott.
So go ahead, you can all start asking your questions right now. Oh, Tolga has a question. What do you think about Ceralymus for the treatment of lymphatic malformations? There are a lot of articles about its toxicity.
Well, there has been a lot of hype about rapamycin or Ceralymus, call it what you prefer, because it is a very powerful and useful drug to treat some kind of lymphatic malformations. I do use it. There are indications basically on big, huge, complex lymphatic malformations, whereas minor or moderate lymphatic malformations are better managed in other ways. There are some concerns about this toxicity in the long term of Ceralymus, but none of it has been proven yet. The only thing we know is that, especially during early infancy, there is a definite risk of infection because it's there is a reduction in the immune system power. So I would just be careful just with, I mean, potential infections, but that's it at the moment.
But there are other options. So
Yeah, as I told you, I rely on Ceralymus for helping few patients. Actually, the indication for Ceralymus is limited to, as I told you, complex cases where you have, for instance, compromise of the upper airways or stuff like that. So functional impairments and the inability to treat it in another way, meaning surgically or sclero or laser, which usually is more than helpful.
okay, thank you for that. And those of you that are asking questions, if you could let us know where you're from, that would be helpful. So Giovanna has a question. My daughter, who is 5, had an orbital hemangioma, which was treated with propranolol. However, she still has some redness in the eye. How can we treat it?
I should see some pictures first. It's difficult to say just this redness. Is it the eyelid? Is it the eyeball? I mean, a lot of variables to consider before I can express an opinion about this.
Right, I agree. You know, and also so many things are called hemangiomas, and so many people are put
Exactly.
on propranolol, and maybe it may not even be that. So I can see that Scott is helping us. Thank you, Scott, and he's posting Dr. Colletti's direct Gmail email there, so you can email Giovanna. You can email him a picture and give him some brief history. What is it, present at birth? Changes, anything that changed with the treatment, did it respond to the drug therapy? And he'll be happy to get back to you. Diane Kirchner is on. She says, my port wine stain is on my left leg at 62. Is it worth getting laser?
It is. In fact, the laser treatments don't only are not just meant to, you know, clear the port wine stain. They are also indicated to prevent cobblestoning and stuff like that. And because, you know, cobblestoning can be quite annoying because they are nodules, very itchy, and they tend to bleed and stuff like that. So yes, definitely there's an indication for laser, even if you're so young.
Yeah, and you just treated a woman. We did a video with you treating a woman's leg that has the stain on it, and
we did.
And it's actually on our website, Diane. You can see it on my Facebook page on Facebook, and you can see it on our website. We went live with Dr. Coletti and Dr. Tremontoni treating a leg, and I was very exciting because I know there's been a lot of controversy about that, but we proved otherwise, didn't we, Dr. Coletti, that you can definitely treat these legs. So let us know where you're coming in from. We have quite a few people on, and so Toga wants to know, which agent do you prefer for tongue lymphatic malformations?
That is a good question. There is some literature about it. There are some, you know, the highest level of scientific evidence are systematic reviews of the literature. And a colleague of ours, Sophie Horbach, published a paper. And one cannot really say that one agent is superior. However, there is one sclerosant that is better tolerated, and this is bleomycin. So when I have to treat the tongue, when I basically don't want swelling to occur, then I do rely on bleomycin, provided this is a simple microcystic lymphatic malformation.
And again, you can email Dr. Coletti, and his email is in the string, and he can take a look at the imaging and give him a history of the treatments you've had to date. That'll give him a better idea of how to respond. The next question comes from Cheryl T. My daughter has been diagnosed with an MAP2K1 genetic mutation that hasn't been given a name as it's a new disease. All we know is that it's a mosaicism and progressive AVM. We are waiting to go to Great Ormond Street. Do you know anything about this mutation?
Of course I do. MAP2K1 is an acronym which stands for mitogen activated protein kinase, and the 2 and the 1 are just the number of many of those proteins. It is not a syndrome, it's a gene which lies behind most of AVMs. So it's not something particularly rare. The opposite is true. Many of the AVMs are caused by a mutation in MAP2K1. There are good news about this, because you have to know that MAP2K1 is a protein that is mutated. Actually, the mutation it's the same as we find in melanoma. So there are drugs which were developed specifically to inhibit the hyperfunctioning MAP2K1 mutated protein. The drug of choice nowadays is trametinib. Actually, Veronica Kinsley, who works there at Gosh, she was one of the 2 groups. One is Veronica's group, the other is the Boston Children's, who discovered that. And they were able to demonstrate that in zebrafish. So I'm pretty sure they will offer you the appropriate treatment for your disease.
Thank you, Dr. Coletti. So Laura Bastini says, hello from Italy. I have a big problem on my right leg due to clipal tronane with ulcers. Can you help?
I think so. I think I can help, but I have to see you in person. It's too difficult for me to just say, yes, I can do this or that. I have to see you in person, and then I'll tell you what are our.
And I also think that, you working with a wound care expert too, Dr. Tremontoni, like bringing her to your clinic on a Friday in Milan would be very good, with the 2 of you seeing her.
Yes.
I bet you can come up with a great plan.
Yes.
So again, his email is being posted. You can see it in the string here, look up or look down, and you can email Dr. Coletti directly. So Ram Malka says, hi, I'm from Israel. Is sclerotherapy with bleomycin effective for microcystic lymphatic malformation of the tongue? Can it reduce the swelling? Can it be applied on the base of the tongue?
I think I just answered that. Yes, it's effective. Yes, it can be used in the tongue, but not every case looks the same. To express an indication on the single patient, I have to see the patient and the imaging. But as a general opinion, yes, it can be done, and bleomycin is my preferred drug to treat microcystic lymphatic malformations of the tongue.
Thank you. So Bianca from Hungary is on, and she says, hello, Dr. Linda and Dr. Coletti. My two-month-old son will start laser at 3 months. He has a port wine covering the right side of his face, eye, scalp, and his gums. Is it possible to treat the eyelid during infancy without GA? Can the scalp and the gum be treated as well?
Well, I think that Linda, you could answer this question. Because
no, go ahead. You tell her.
No, I mean, yeah. No, sorry for laughing. No. It's because yes, we do it actually every week in newborns, in babies 15 days old. We put a corneal shield We never use GA. So yes, we do start early. We do treat the eyelids. We can treat the gums, but that is not necessarily a good idea. I usually wait to do that, but yes, it can be done.
So you can email Dr. Coletti and get the information about that. Lao San writes and says, my son is 4 months old, has a port wine on his forehead. From what age do you recommend it? And I know you just answered this question, but the answer is as soon as you can get the baby to you.
You know, I learned laser from the best, I think. Dr. Roy Geronimus and Dr. Stuart Nelson. And I have to thank you, Dr. Linda, again, because you made this possible for me. So I followed their philosophy and your philosophy, Linda, which is called done by one. So what we try to do is we try to achieve the best result before the age of 1. This is why we start as early as we can. There are many reasons. First, the skin is thinner, so the laser penetrates better. Second, the vessels are thinner, so the laser wavelength acts better. Then there is less melanin, which works against the laser by absorbing energy. And then the absolute size of the lesion is less than it will be when the baby grows older. And also, the sooner the better in the sense that we can do it without GA, because the baby's long-term memory and self-awareness will take place after the age of 2. That's the threshold that we use regularly. So this is what lies behind our philosophy of the done by one phrase says.
Thank you. A question, do you have any experience about PICRAY for the treatment of lymphatic malformation, PIQRAY?
Not really, no. But we are working on something which is indicated in more complex lymphatic malformations. For instance, the one that cause facial elephantiasis. And what we are doing is we do electrochemotherapy. So we inject the sclerosant, and then with some very fine, tiny needles, we pass some current, low voltage, which opens the cells, and the bleomycin can penetrate the endothelial cells. So the result is better than just the sclero in selected cases where this is indicated.
Okay, so the next question is great. It's from Melinda Anderson, and we saw her child at the super clinic in New York in October. He was a 2-year-old little boy with a stubborn port wine stain. He was kind of wiggling around, and so you did the best you could, but you did say you thought there was some potential high flow under it. And she wants to know, she finally got approved for an MRI and wants to know, is it worth him going under GA to get the MRI, or should she just come to the super clinic in California in October and try the ultrasound again? Which do you think? Or both?
Well, you know, it's not always easy to make an ultrasound in a very young baby, because I need my probe to not move, to analyze not just the colors that I see, but the wave of the blood going through the vessels. So I think that if someone recommended you to do the MRI, then I would do it. Just one GA, it's not a problem.
Great. And then she can always share that information with me.
Sure.
And you can take a look at it. Okay, so Danny Wagner said, what can it mean if my son's eye is dilating bigger with a port wine stain on that eye?
Mm-hmm. Okay. As you know, Sturge-Weber syndrome is characterized by 3 basic signs and symptoms. The first is the facial port wine, the birthmark. The second is the involvement of the meninges, and this has consequences on the development of the brain and on hypothetical seizures and so on. The third is the pressure of the eye. If the pressure inside the eye is too elevated for a prolonged time, then chances are that the baby will develop glaucoma. So this pressure excessively high will cause some ischemia on the retina and the baby will lose sight. So the first thing I will do if the pupil is dilated, I would go very soon and have some tonometry. So measure the pressure inside the eye as soon as you can, just to rule out glaucoma.
Agreed. Evelina from Sweden says, I have a 10-year-old son with clipal trinane. He uses a compression stocking since he was 3 months old. So that's over 9 years, yeah, because she says he's 10. He's had 3 surgeries to remove embryonal vein. I think it is hard to know what's the next step. What can we do to prevent further negative development? Do you have any ideas?
Well, yes. I mean, compression garments are what I would indicate in this case. But I have to tell you, I'm not quite the good expert for you because legs are not my thing. I suggest you ask Dr. Delfanian, who's a clipal trinane expert. Ask Dr. Linda about him.
Yep, we can, if you email me at vbfpresident@gmail.com, or Scott's on, he might be able to post in the string here Dr. Delfinian's direct email. If it is not there, just email me at vbfpresident@gmail.com, and I will connect you with Dr. Delfinian, who can he can kind of guide your path. So now we have Jennifer from Wisconsin. Her 2-year-old son has a port wine stain on the top of his gum, which bleeds easily. He's had treatment on the part of his face that has a port wine, but not his gum. Is this something that should be treated? If so, is it worth traveling far distance to see a dentist? I'm a little concerned that the gum is bleeding. I'm wondering if there isn't a pyogenic granuloma there, or would the gum...
That's what I was thinking too. This is very unusual. Well, there can be some erythema, redness on the gums, but bleeding is exceptionally rare. So I would further investigate that before we say anything about treatment.
Yeah, and Jennifer, I know Scott's monitoring right now, so if he could provide you with Dr. David Darrow's email. He is our gum and dental expert in the US. He's in Virginia, and he could, if you can do a short video of the gums and send it to him, he can give you an opinion. So that's Dr. David Darrow. And if his email is not posted here, again, we can get that for you. You can email scott@birthmark.org, or you can email me, vbfpresident@gmail.com. Okay, so Michelle is on from the US. Her son has a port wine stain on his left leg and has undergone 13 treatments since birth. His port wine has lightened, but I was curious as to when he will begin maintenance therapy, as the port wine on his arms and legs are more difficult to treat.
Yeah, well, everyone has his or her protocol. So I suggest you to ask that to the doctor that used to do laser on your son leg and arm. If you prefer, I can give you my advice if you send me some pictures.
Thank you for that. So Zinc has a question. Oh, I'm sorry.
No. I was just saying, as a rule, I very often do 1 or 2 treatments a year, even after years have passed, just to prevent worsening.
Correct. So Zink, I'm going to answer this. He wants to know about the side effects of Sturge-Weber and how can we observe, and maybe it's for a child. On our website at birthmark.org, click on the image you see of Sturge-Weber syndrome. There's nine tiles, each one's labeled with a birthmark type. I just completed that booklet last year with Dr. Ann Comey, and it is the 50 top questions that parents ask about it. And it is fabulously informative. It will help you with observing for any eye issues or seizure or the stain itself. So I highly recommend that you look at that booklet, because what are the side effects of Sturge-Weber on the right side of the face can have a lot of answers. And again, I suggest you look at that booklet by Dr. Comey, and then if you have more questions, you can email me and I can put you in touch with Dr. Comey or Dr. Pinto, our two Sturge-Weber syndrome experts. Is there anything you want to add to that, Dr. Coletti?
Not really.
Okay, thank you. All right, so we have another question. Dr. Linda, thank you for your great effort. I love Dr. Coletti and Dr. Linda. Dr. Coletti, this is Imad Ekhaled. Dr. Coletti will be my son's doctor in the near future. So bravo.
Yeah, hi.
And they're from Lebanon, and they said, thank you. Alana Bonavoc said, you mentioned treating me with the YAG laser for my next treatment. Can you tell us the difference between the YAG and the pulse dye laser? Thank you again for treating me in Milan. That was Alana Bonavoc?
Yeah. So when we say laser, we're not saying very much. What we say with laser is that we are using a radiation of a certain wavelength, and to, reach some chromophore, which in turn means a substance that will absorb that wave radiation and transmit it to the surrounding tissues. So every wavelength, for physical reasons, can penetrate more or less deeper. And for instance, the PDL, which is 595, penetrates very little. The longer the wavelength, the deeper the radiation will penetrate. And YAG, or neodymium YAG, as we say, is 1064 nanometers, and that goes much deeper. But it is a stronger form of energy. It has indications that are different from the ones that PDL has. So when I say, if I did put an indication for YAG, it means that there is some hypertrophic or thick skin, or the lesion is more blue rather than red. So these are the indications for YAG instead of PDL.
Thank you. This is a very interesting question. Our good friend from India, Batul Kaushals, she is recently been undergoing treatment for breast cancer. She's down to her last two Herceptin injections, and she said her foot swelled up really bad, but she said after 2 days it did go down, but her KT leg just really was reactive, and she wants to know, she said the swelling did go down. So with her finishing her Herceptin, like, can she begin treatments now for her KT?
I'm not 100% sure, because we should further investigate why she had that swelling. So any thrombosis, any closure of some vessel in the leg, and so on. So I can't really say now.
Right, and also the generalized lymphedema that often accompanies chemo or radiation, correct?
Well, as a general rule, yes, but that highly depends on what chemotherapy drugs were used. So it's not that easy to answer this question.
Right. So one of the things, Batul, is we do have our super clinic in California in October. I think everybody will be able to travel by then if you want to come. Dr. Rosen will be there, Dr. Delphinian will be there, Dr. Coletti will all be there. It might be a good plan, you know, for you, and then maybe we can make a plan at that time for what treatment you can start. It's just an option. Also, I'll be back in Italy in November for our next free laser clinic with Doctors Colletti and Dr. Tremontoni. So I will be back in Italy then. Tatiana has a question. Hi, Tatiana. Hi, Dr.
Hi.
Linda and Dr. Coletti, sending
You
all my
promised me to come and see me soon. You didn't.
She's sending all her love from Luxembourg. She said she'll be back for another treatment soon. So she's just
How are you doing, Tatiana?
Yeah, how are you healing? You can just let us know. She's the star of our video. She's been immortalized in our video. Okay, so Ein Mac has a question. I'm from Northern Ireland. I have a LVM on the left side of cheek, palate, tongue, and next. What are the neck? What is, oh, I guess it's a lymphovenous.
Lymphovenous.
Yeah, lymphovenous malformation. What are her treatment options?
Okay, true lymphovenous malformations are rather rare. Okay, it wouldn't be the first time in my career that I received a patient with the diagnosis of LVM when in fact it was a pure lymphatic with some vessel going around it. Still, if it was it, my protocol as a general rule is I start with sclero. I rely on different type of drugs. I use bleomycin, doxycycline, STS, sometimes ethanol, and try to clear as much as I can with sclero. And then I use surgery to remodel, debulk all the areas where the malformation may have caused some overgrowth. And there is a role for Ceralymus as well that can manage the vesicles very well, if need be.
This is very interesting because I'm just posted and she's from Northern Ireland. And then right below her is Tanya Chambers saying, hey, I'm from Northern Ireland too. And I have an LVM in my left cheek. You know, so in her left cheek of her face, she has an LVM as well. So both of you can email Dr. Coletti. His email is here. Any imaging studies, anything that you have, any biopsies or any information like that, you can send it to him. And then if you decide to go, you can guys meet each other. you can both meet in Ireland and come and see Dr. Coletti together, because we have a couple other patients. Our buddy Sean is from Ireland as well, and he comes to Dr. Coletti from Ireland. Okay, so Sally Joe, so I'm sorry, so Tanya, you heard what Dr. Coletti said about treating it, the different approach, and it applies to you as well. So first he's got to know for sure that this is an LVM, especially because there's two of you. And then second, he'd have to look at any studies that you can provide him so he could confirm that it is in fact an LVM and then give you a treatment plan. So Sally Joe says, my 16-year-old daughter has an AVM in her lower abdomen, anal rectal area. She bleeds heavily when having bowel movements. We've been told to try experimental cancer drugs specific to her genetic profile. Is this too new to know if it's effective as a treatment?
Well, good question. Well, first of all, I would need to know what is the mutation that she has. In any case, drug therapy now seems really promising. Sorry, because we have specific inhibitors of the proteins that are mutated, And also we have other drugs such as thalidomide, which is very effective in stabilizing the vessels. I also use doxycycline as a vessel stabilizer. So drugs are quite a lot effective in some cases of AVMs, especially the ones that are not amenable to surgical resection. So I would say, yeah, chances are you can benefit from it.
Again, if you'd like to send the case and the information to Dr. Coletti, he'd be happy to review it. And before I ask the next question, I guess I'm curious, have you ever operated on one like in this area, or have you seen one in this area?
Yes, I saw a patient last week. He has an AVM right there and also one in the face. So this means that the mutation is in the germinal line, not just somatic. But yes, I know how difficult it is to live with AVMs in that area. So I wish you luck.
That's why I call them the name I call them. I call them arterial venous monsters because they can be a monster to manage. Okay, so Irish Lassie number 2, Tanya. Hello, Tanya. She's back. And I love her question. She's saying, I'm being prescribed a macrolide antibiotic called erythromycin. We know about that. 500 milligrams twice daily for its anti-inflammatory properties. Is this drug similar to Ceralymus? She's in the UK. She's from Northern Ireland, but she's currently in the UK.
Could you repeat the name of the drug?
Erythromycin. That's like the doxycycline, right?
Oh, it's a doxycycline, yes.
Yeah, yeah.
So yeah, it's not, well, you know, Ceralymus is a macrolide, bleomycin is a macrolide, doxycycline is a macrolide. So the family is the same, the drugs are very different from each other. The reason why we do use doxycycline is that doxycycline is an inhibitor of some proteins which are called matrix metalloproteases, which are used by endothelial cells to degrade the interstitial tissue to make room for new vessels. So by inhibiting those proteins, you basically stop angiogenesis or slow it down to a significant degree. So yes, it's a good drug to use in that case. 500 though, it's a lot.
Yeah, and she's on it. That's what I was going to say to you. She's on 500 twice a day. That's 1,000.
That's a lot. That's 5 times the dose I use.
And also, why don't you speak, because both of those ladies are on there, would you use your protocol with the progesterone only birth control with that for these supposed LVMs?
Plus doxycycline.
Yes, plus the doxy.
I have to see.
Yeah, so you again, Tanya, both of you, Dr. Colletti's email is above. Alana is saying thank you. It was great to see you both again. Thank you, Alana. Okay, so Tanya is saying hers is a microcystic LVM. Again, I guess you'd still have to know more about it, right?
Yeah, microcystic doesn't refer to an LVM, but it's referring to the lymphatic part of the malformation. So as I told you, I really have to see you to be sure this is an LVM versus pure lymphatic.
And by the way, everybody, Dr. Coletti has a really small ultrasound device that does really big things. We've been using it at our super clinics. He and I did 54 ultrasound cases together over a 2-day period. And these are definitive. They tell high flow versus low flow versus capillary, lymphatic, venous. And just at this conference that we just, or the free laser day in Italy, there was a patient that had been told by a leading center they had AVM, and we found out it was a congenital hemangioma, which was great news for the family. So coming to our super clinics for these free ultrasounds can be really life altering and diagnostic altering. Wouldn't you agree, Dr. Coletti?
Oh, yes, it is. Definitely.
So
I think
again,
every doctor who deals with vascular anomalies should be able to use an ultrasound, him or herself.
I agree, and that's why we
Definitely.
have this service now at every one of our clinics. And again, we'll be in California. Dr. Coletti will be here in the US, October 7th and 8th in California. We have the ultrasound and the free laser on Friday the 7th, and then the consultations and overflow of ultrasounds will be done on Saturday. So he will be in the US on those 2 days. Oh, we got a third one from Ireland. Hello, James. We have a lot of the people from Ireland on today. He says, our 3-month-old son has a port wine on his arm and doctors don't know what it is that's on his leg. We are unable to get treatment for a number of years in Ireland. We would have loved to see you, but couldn't get his passport. Well, first of all, let me just say this, James. Dr. Colletti has a VBF flat fee that's very affordable for families that come to see him. And he runs his laser clinic every Friday. You can send him pictures and he can tell you, you know, maybe because they don't know what it is on his leg. I'm not sure. We'd have to look. I mean, it could be any number of things, but if there's a port wine stain on his arm and something's on his leg, it's likely related or connected. It could be like a cutis marmorata, I don't know. But you can send Dr. Coletti the pictures and you don't have to wait 3 years. You can organize yourselves, get your passports in order, and he will give you the super discounted VBF fee. So for any treatments that you have, and it's a flat fee no matter how big, how large. And he does this every Friday in Milan. So we thank him so much for this. Tanya is saying she does struggle with the dose and she uses the progesterone only pill. So that's good. But you can talk to Dr. Coletti, Tanya, because it is really a crazy high dose. And I don't know why they have you on that high dose, but I've never seen anything about that kind of dose in writing. I don't know if you have, Dr. Coletti, but 1,000 milligrams a day, that's crazy to me, crazy high.
Very, very high.
So Bhushan Patil says, can we start giving aspirin 75 milligrams to kids for vascular malformation case? The kid is 4 years old. I guess it's hard. Yeah, go ahead.
Yeah. First, we have to know which kind of vascular malformation. Second, what's the purpose of aspirin? So without knowing what are we dealing with and why we should want to give some aspirin, then the answer is no.
Right. And so, Brushan, if you go to birthmark.org, up at the top, it says find a doctor. You'll come up with a search map and type in India. And there are 6 experts on our page from various regions of India. And you could just email them or contact them all, send the picture and see which one would be closest proximity to you. But there are 6 of them on there. We just recently added a couple more, thank God, because for years we didn't have anyone in India. So we're really, really happy to have those. Okay, so we have a question from Gabriella. She's from Bulgaria. Thank you for the free clinic in Milan. You are amazing. So she was at our free clinic. Gabriella Rachiva. Mm-hmm. So we're happy, and we will be back, Gabriella, in November for another free clinic. And of course, any of you at any time, Dr. Coletti is in Milan on Fridays at Laser Plus, and he always has his handy sidekick ultrasound with him. He doesn't leave home without it. So on Fridays, you can not only get—
I carry it in my backpack.
In his backpack, I know.
Seriously.
I know, it's like a child, like it's very precious, and he makes sure it's always there and safe and that nobody bumps it or does anything to it, and makes sure it's always charged. Well, we've been all over the world with your laser, so I mean, with your ultrasound.
We were.
Yeah, so we know. So anyways, any of you that want to go and get pretty close to a definitive diagnosis can go on a Friday to Milan, email Dr. Coletti, make an appointment. He does the the laser. It's free twice a year when we have our free day. And then he can do the ultrasound. So not only would you get a laser treatment if you qualify, because not everybody qualifies for laser. You know, some are just too deep or too big or complex for the laser, but you can get a definitive diagnosis with the ultrasound and the laser at the same time. No, neither requires anesthesia. If it's an adult and it's thick on the face, he can do a nerve block. So there's just really many options for you. And again, his information is here. Yes, James, you can email him directly, Tanya as well. Okay, so we are caught up with our questions. So if any of you have any additional questions, Dr. Coletti and myself, we will be in Vancouver for a meeting, and I may be secretly telling them to bring the ultrasound so we can possibly see some patients from the Vancouver area when we're there. Why not, right? If we're there, have ultrasound will travel. So, oh yeah, she's in Downpatrick. I'm not sure where that is. I guess that's in the UK. So, and share support. Yes. So you can email me too. And oh yeah, so she's talking. This is cool because some of the patients from Ireland are now messaging back and forth with each other and making a connection. So that's
great.
really great. It is great. Julie Rhodes says, my son has multiple intramuscular VMs. He recently had an episode of very easy bruising. His lab results didn't show why. Slightly low iron and slightly high clotting factor. Doctors could not determine why he was bruising so easily. It went away. Since then, he has been having a hard time sleeping. That's interesting.
Well, multifocal venous malformations are a difficult disease to deal with. This must be clear. You know, bruising could be the result of consumption of clotting factors. And I'm not sure if the blood work was done in time enough to say how he was at the time when he was bruising, you know, because something that happens in multifocal venous malformation is called local intravascular coagulation. This means that inside the chambers of a venous malformation, the blood may flow so low that it stops. And when it does, a clot occurs. It consumes clotting factors. Then there is an inflammatory reaction around it. So there is pain. There is some, you know, breakdown of the walls of the vessels. So some bruising can come from that too, you know. So again, if you want to write an email to me and describe me all the details, then I give you my opinion.
Thank you for that. Bushan, Dr. Coletti said he really can't tell you to start taking aspirin for your son's malformation of his leg because he really doesn't know what's really going on. Nobody can really do that. That's why I said, if you go to the 6 doctors that we have on our website in India, a lot of them have emails and phone numbers because we don't know what you really have. I mean, you call it a lymphatic malformation of the leg, but typically aspirin is used for clipotrenane, but since your son's not his patient, he really can't tell you to start taking the aspirin or not. It's just something you have to follow up with someone from your country. So Ram Malka said, is sclerotherapy done in Israel? Okay, so here's the good news, Ram. Write this down. Dr. Adam Farkas is in Jerusalem. He studied at Sinai in New York City, and he's there now putting a vascular anomalies team together, and he is an interventional radiologist. So he can do sclerotherapy in Israel. and he trained with the best in New York City. If you can't find him, email me at vbfpresident@gmail.com, and Ram and I will give you his direct email. So Carolyn is watching. So, okay, so if anyone, we have 10 more minutes for Dr. Coletti. So any questions? And again, Dr. Coletti's email is posted. You're welcome, Bashan. Dr. Coletti's email, giacomo.coletti@gmail.com. My email, vbfpresident@gmail.com. You're welcome. Oh, good. So you do see Dr. Farkas. Well, there you go. You got the best. That's the best doctor in Israel that treats vascular anomalies. And actually, Dr. Weiner, who's one of our doctors, is traveling there 4 times a year with Dr. Farkas. And they're hoping to bring a pulse dye laser to Jerusalem so they can start doing laser cases as well. So this is all happening, like COVID, interrupted a lot of these programs that were going to start. So hopefully now they can start it back up. So when you see him, Ram, you can talk to him too, that, the laser we're bringing the laser to Jerusalem. So Marin said, my son has a port wine stain on almost all of his face. After the first laser, he didn't have red spots where the laser is done. Does this mean the laser is not effective? Without, she's saying the purpura. The laser was done and there was no purpura. Does that mean it's not effective?
Well, there is some discussion about this. I can only tell you my personal experience. And my experience is this. It depends on which vessels you are targeting. If you are targeting smaller vessels, such as the ones that you aim to treat earlier on in the first phases of the treatment, then you have to have purpura in order for the treatment to be effective. If you don't have purpura, this means that the vessels were not destroyed by laser. So it's rather difficult that the treatment will be effective without purpura. Later on, when you are targeting bigger vessels, then the purpura, although more probably will be a good sign, it is not necessarily, it's not indispensable to have to obtain a result. In general, I prefer to see some purpura.
So Marin, if you want, you can send Dr. Colletti a before and after picture, let him know where you live. We have this year, the remaining free laser clinics we have on May 20th, I think it is. We are in Washington, DC at the medical center doing free laser. In July, we will be doing free laser in Greece and we'll be back in Italy in November, and in October, we'll be doing free laser at the super clinic in Irvine, California with Dr. Nelson. So those are some options for everyone. Okay, right, and so yeah, everybody's waiting for Dr. Weiner to show back up in Israel as soon as the doors open up for travel. So my son has a poor, okay, yes, so we did that. All right, so you got that answer, Marin, and you can send him pictures of before and after. Thank you. Hi, Lordan. Lordan is on. We're sorry we missed you and the baby at the free laser clinic. As I just announced, Lordan, we have a free laser clinic coming up in Washington, DC in May. Possibly in Greece. It's looking like we have a meeting in Greece, so we're likely gonna have the free laser there. And that'll be in July, and then back to Italy in November for we've made a decision, Dr. Coletti, myself, and Dr. Tremontoni, that we will be doing 2 free laser clinics a year in Italy. Likely the same setup we just had, a March and November will probably be the way it'll work twice a year, just because of the demand in Europe and neighboring countries to have the free laser. And then, of course, we have, Lord, and we have the super clinic that'll be in California, and Dr. Coletti and Dr. Nelson and Dr. Geronimus will all be there as well. So I know she's saying hi. And I hope David's doing well. So thank you. We will try to come to Italy. Again, everyone, before we wrap up, we have 6 more minutes so we can take some additional questions. But while we're waiting for the next question, you can email Dr. Coletti directly. His email's been posted several times by Scott, our new COO of VBF. So thank you.
Congratulations, Scott.
Yes, thank you. We're all excited that Scott's joined us full time as our chief operating officer. And he will be making his way to Italy to see you too. So we'll be working on that, right, Scott? So again, Dr. Colletti will be in the US in October on the 7th and 8th, where we'll have our free ultrasound, free laser, free dental, free orthodontry, and our psychotherapy sessions. That's our big one of the year. And that's over a 2-day period, October 7th and 8th. And then I'm back in Italy in November at the Laser Plast Center in Milan. So any of you that are, if you can get to Italy, you can get treatment. That's all I'm telling you, right? If they can get to Italy, they can get treatment. And at the very least, you can get the ultrasound done. And he has a flat fee for just a very discounted rate for that as well, so that you can at least get a definitive diagnosis, especially those of you that, you obviously have had multiple diagnoses and you're not sure. Oh, hi, Kimberly. Kimberly Steele's on. Hi, Dr. Steele. Just a comment. Thank you for that. All that you do. You're both incredible as you help and support the vascular birthmarks and Anomaly community. And her son has a very rare lymphatic vascular anomaly that's in the Kaposi form. So it's one of only a few cases. It's LVA, lymphatic vascular, or LK, lymphatic Kaposi form. So I always get it mixed up.
KLA.
Yes, Kaposi
form lymphangiomatosis.
Yes, and she's a physician.
Yeah, it is a type of lymphatic malformation, which we call a general lymphatic anomaly, such as the general lymphatic anomaly GLA, or the central conducting lymphatic anomaly CCLA, or the Kaposi form lymphatic anomaly and stuff like that, or the Gorham-Stout as well. Everyone has its typical features. I think, well, I'm pretty sure that there is space for Ceralymus to treat that.
Yeah, he's, she was very rigorous as a physician herself, and it was serendipitous that they actually got the accurate diagnosis. And so she's now joining one of our committees in VBF, and hopefully she'll bring her son to California. Yeah. Oh, yes. She said he's under the umbrella term complex lymphatic anomaly.
Right.
Right. And again, and I want to work with her on this area because we're trying to track down these children who probably have a 95% misdiagnosis rate because it's so rare. And we're her and I are going to work on a way to reach out to the general lymphatic community, because we're both sure there are these cases in there, and it's just not certain. So I'm really excited that her and I are going to be working on this together. So thank you for chiming in, Kimberly, and I hope that you'll get to meet Dr. Coletti in October at our super clinic in California, and bring your son, of course, because we can all learn from each other. And I think that's a great closing for this phenomenal session that we've had, which is that VBF isn't just comprised of families that have been affected by vascular anomalies, but that's very important to me. But we've also had over the years many physicians. As a matter of fact, one of our top surgeons in the United States, Dr. Gregory Levitin, he got involved because his daughter had a hemangioma and he was told there was no treatment, and he took her to see Dr. Wayner, and Dr. Wayner removed it. And then he said, I want to learn how to do this. And he was worked with Dr. Wayner for years, and now he has his own vascular anomalies program. So a lot of physicians come to us for education, and a lot of families, we always use this number, which is true. Like less than 3% of the general population know what a vascular anomaly is, but the sad truth is less than 10% of the doctors. That means there's a 90% gap in knowledge, and that's the focus of the VBF, and that's the focus of our partnerships with these world-renowned experts like Dr. Coletti, as we work together to educate the families and educate the physicians. So I'd like to thank you, Dr. Coletti, for a very, very successful
pleasure.
session today. As always, you always do a great job for us. And again, you can see in the string, if you'd like to contact Dr. Coletti, then you can go directly and email him or myself. I'm going to go back to the Zoom meeting and end this. So thank you, Dr. Coletti.
Thank you, Dr. Linda. It's always a
Thank you.
pleasure and an honor.
Thank you.